Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
I'm excited to have Dr. Nadine Finigan-Carr, but affectionately known as Dr. Nay. She is the executive director of the UMB Center for Violence Prevention program here on campus. And I'm excited to have this conversation because we've been missing each other's schedule conflicting, but we finally had a time to sit down and talk to.
The stars aligned this week. The stars have aligned.
Yes, the stars have aligned. And I appreciate your time. And we're going to get right into it. And the UMB Center for Violence Prevention program is an interdisciplinary and collaborative approach to violent prevention. Those are big words, basically, Dr. Nay, that says what?
Sure. So it means we work with and not against. We work with and not for. And we do that not just specifically social work or medicine or law or pharmacy, but across all of the 7 types of disciplines here at the University of Maryland, Baltimore, as well as across the communities here in Baltimore and the state. So we're not specific to Baltimore, but we are of Baltimore, right? So, but we have a statewide impact because, as you know, violence isn't just a Baltimore problem, despite what some of the media would have us think. And as the provost reminds me, you know, Baltimore is in our name, but so is Maryland. And so it's the whole thing, right? Like we might be in Baltimore, but we're of Maryland, and we work together with everyone to prevent violence in all of its forms. So that's what we mean when we say interdisciplinary approach, right?
I like that. Work with and not for, work together, work alongside. Here in the Patients Program, we understand the importance of meeting the community where they are.
Yep.
And I think those words go hand in hand when we talk about helping the community, bridging the gap to the community, and addressing some of the needs in a realistic way. So I'm excited. I know last year, about this time a year or so ago, I actually had the opportunity to attend your soft opening or soft welcoming to the university. And I was excited to see that it was filled with community members that I may have seen in a long time, but stakeholders who really, really have a hold in the community and understand how important it is to give back. And I think some of those folks also align with your mission statement.
Yeah. And that was intentional, right? Like,
yes,
we started and we are, the Center for Violence Prevention is 1 year and 17 days old today, right? Like we only started last year. And we were very intentional in starting with community and all of its forms and coming to the work being informed by the community, because it's important to us to lead with our why before jumping in with the how. Yes. And why is the community, and the why is what the community as a whole needs. And then the how is the stuff that universities are used to doing, but we need to do it from the center of what the community needs and our why. And so we were very intentional from the jump to engage with various community voices throughout the city and throughout the state. I felt for a little while, it felt like I was on this like listening tour. It's like every time I turn around, like, oh, you're in nothing but meetings. I'm like, yeah, I'm purposefully meeting with people to hear what the needs are. I don't want to start out by saying we're going to do X, Y, Z, and the community wants A, B, C, or even better, you know, they want R. Like they don't want any of those letters, right? Like it's like, oh yeah, we're going to do X, Y, Z. I know we're going to throw in a little bit of what no, they don't even want any of that. They want this one. And so we needed to make sure that we had an understanding. A lot of the time people I mean, when they hear violence, they automatically think, guns and shootings and stabbings and violence. There's so much more to it, and the community knows that.
I know you guys are only a year old. Can you talk about some of the ideas or programs that you guys want to work with the university or work with some external groups to tackle and address some of the violence that's going on here in Baltimore?
Mm-hmm. So first of all, what I say all the time is violence is the child of poverty and trauma. And you can't address the violence if you don't address the root causes, which are poverty and trauma. If I have everything that I need to survive and my well-being is supported, and because you can't get through life without experiencing even the smallest of traumas, right? The smallest of traumas even being, moving from one house to another can be a trauma for someone. But if you don't have what you need to cope with whatever the level of trauma that you are experiencing are, then you do end up acting out in such a way that could become violence eventually, right? And so what we're trying to do when we've been meeting with community people is getting an understanding of what are the issues that are causing trauma to occur. And so what we have been able to do here at UMB, we started pretty much off the bat in the fall, is we've been trying to get a sense of what are we already doing here at the University of Maryland, Baltimore, to address poverty and trauma, which begets violence. So what are violence prevention programs? What are our trauma-informed care type programs that we already have here at the University of Maryland, Baltimore, in any of our schools and at the University of Maryland Medical System in shock trauma, primarily in our emergency department? What are we already doing to address these issues? And so our first thing that we rolled out, and it's still active now, is a survey that we've been pushing that says, what are you doing? And it doesn't have to be, sometimes we say, well, that's violence. No, it's not. I'm doing substance abuse treatment. I'm doing, that's part of it. So we're trying to really get a comprehensive understanding of who, what, where, and when, literally, we are doing here at the University of Maryland, Baltimore, because we tend to work in silos. So medicine doesn't know what School of Medicine doesn't know what the University of Maryland Medical System, right in the same building sometimes, is doing. Pharmacy doesn't know. Social work doesn't know. And we're all doing programs because we all have the same mission at the university to serve this community of Baltimore, but we don't always know what we're doing. So our major push has been to do a complete environmental scan of the university and the medical system, that the part of the medical system that's here, to get a sense of that and put that together in a format where we can then use it. We can all use it, right? Because here's the thing that happens. So you have someone who is seen in shock trauma who needs, some sort of counseling, therapy. They don't just need the referral to the actual medical treatment follow-up, but they also need services that they may be able to get from social work. They may be able to get, for example, one of the first things that I learned when I got here was the fact that there is a special student dental clinic for people who have been victims of trauma. Do you know how important that is when you are a victim of intimate partner violence and your abuser may have hit you in the mouth in such a way that you lost teeth, or you need root canals and you need all of these services that you may not be able to afford, or your abuser may not pay for if you're still with them, to know that you can be referred to this special type of clinic. So those are the types of things that we're trying to get a sense of and put them together in a way that can be used by the community external to the university, as well as by us internal to the university, so that we know who can we partner with. How can we work across our regular silos to even refer patients and clients and people who need our help? And so when you think about that, you might be like, well, that's not violence, but it is. Because literally, if you treat that person.
No, I understand what you're saying, because it's kind of relative to some of my colleagues or friends who are teachers or principals in schools here in Baltimore City. And, they talk about the kids acting up. It's towards the end of the year and everybody's ready to get out. But they always talk about to say that if this kid is acting up in XYZ class, it might not necessarily be the main reason what's going on now in school. It could be some stuff going on at home. Mm-hmm. So the principals or the guidance counselors, the teachers who kind of go the extra mile, they always reach back out to their parents or their home or their coach, whoever's around them, that can kind of give them a little bit of insight on what's going on with the student. And most of the times, you're right, it's not that incident in school. It could be some issues at home or outside of school that's now being a root cause of the problems that they're having in school. Mm-hmm. Back to something that you said earlier, you talked about organizations here on campuses or groups on campuses not necessarily knowing what the next person is doing. I believe in not recreating the wheel.
Exactly.
Right? Also, if it's not broke, don't fix it. Mm-hmm. Can we talk about some of the roles or partnerships with other organizations or government agencies that you think that can come together and help strategize to address some of that? Because I believe if someone's doing it here, hey, how can we just take that and literally pick it up, bring it right over here, and boom, especially if it's working.
Yeah. So it's interesting that you say that. So one of the and it's funded governmentally in some cases not. But part of the reason why I want to get an understanding of what everyone is doing is because some of the time, even outside of the university, they don't know that medicine is separate from social work, is separate from whatever. So the very first time that I spoke to someone at the Mayor's Office of Neighborhood and Safety Engagement, Muncie, about this work a year ago this time, right? When we're starting this work, and the very first time I met, and I said, we're working across the seven schools and the University of Maryland medical system to, she stopped me. I didn't even get to what I was finished. She was like, wait, there's seven
schools. Yep.
And so having that understanding that when you're working with social work, that doesn't necessarily mean you're working with pharmacy or with, that they'll know. But the governmental agencies that we work with, the nonprofits that we work with on a regular basis don't see that. What they see is that nice lady over in pharmacy helped me get the drugs that I needed. Why didn't she also tell me that I could have gotten therapy for my son over in social work? These are the things that, because we don't talk, they don't know. But this is why we want to make sure that not only do our schools, faculty, staff, students know what each other is doing, but have a sense of how we can share that and be better sharing that outside of the university, so that governmental agencies, organizations who want to work with us know how they can work with all of us, specifically in my case, for violence prevention. And it also is just good sense, because a lot of the larger federal grants to address violence prevention, they require collaboration. And it makes sense to collaborate inside of your institution and external to your institution. So having a sense of what we all are doing, being properly connected to mayor's offices or the health department or, other city and state agencies in an authentic way to complete the work is actually a strength when we go to the next level of federal agencies and larger foundations who may want to fund this work because we can show, oh, this isn't just a one-off. This university is invested in violence prevention in the wider community, and they're working with this governmental agency to do so as a complete entity. And that's why this is going to work in Baltimore and in Maryland.
I definitely believe it will work. It's going to work. And it kind of reminds me of when I'm out sometimes at a health fair event, and I'm vending for the patients program, and we're there talking about opportunities to participate in non-clinical research. But at the same time, I'm in a group or a room with other people who have resources. And a lot of times, if someone comes up to my table and they don't have interest in what I got going on, I'm not going to turn them away if they have other interest in social work, dentistry, because on my table, they see the University of Maryland School of Pharmacy, and they think that we understand everything that's revolving around medicine, or yep. I know the 4 or 5 dentists in school of dentistry, and I know 10 social workers over at School of Social Work. I don't know it like that, but at the same time, I take it to heart that said, okay, cool. You might not be interested in what I got going on right now, but let me see if I can connect you with someone who can help you in your journey to get better, whatever your situation is, because, that's important. And you talk about overcoming some of those challenges when you're dealing with other organizations. How do you plan to strategize to work with not only internal folks here on campus, but also external folks on campus?
Our first year, we spent most of our time building these authentic relationships with external and internal community members. We've been building this relationship, right?
Yeah.
And we've been very, very, very intentional about that because, again, I wanted to make sure that the work we're doing is led by the why, and not us just stepping in and saying, this is how you should do your, whatever. This is how violence prevention should be in Baltimore City and in Maryland. And so what we're doing right now is actually getting a sense of how to do the next level of the work based on what we've gotten, based on the passion and the why we've gotten in the community. And so we've organized our work in what I refer to as like 4 buckets. And the first bucket is still the community, right? So the community hub, the community bucket is our first one. And that is where we're getting, the input from the community. We're listening to community voices at every step of the way as we're developing everything that we do, even in terms of which grants we should go after, which ones make sense at this point, and making sure that as we're going after even new grants, that the research questions are informed by the community members, and that in some cases, community members are co-partners in the application, not just a checkbox, not just a letter of support, but an actual part of the application and a part of the work, not just a subrecipient for the sake of needing a subrecipient. So that's our main bucket. Our second bucket.
Nadine, I'm sorry, before I cut you, before you go to the second bucket, because what you said is important and kind of familiar to us here at the Patients Program. When you talk about working with the community members and they are not necessarily participants, but they're helping you actually guide. How important is that to you? And can you share some feedback from some of those community members that maybe have stepped into a different role that they didn't know that they could be in or they weren't prepared for? Because those are some of our most amazing stories here at the Patients Program as well.
Yeah. So I will say we were blessed in 2 ways this past semester. We had an MPH student who worked with us on her practicum.
Okay.
And we had a research question that had come from a community member. And so her practicum that was in support of us and able to start getting data on this topic, and I'll get to the topic in a second, was based on a question that came from this community member. What people tend to see, what you hear people say, oh, people are getting arrested, or, the incarceration rates are high. And, Baltimore, as you said, you went all these places and the first thing coming out of people's mouth is, oh, the home of the wire. Well, what does that look like? What does the data say? What does that look like? And so the initial question, and we still haven't even answered the question. She only helped us to touch on the beginning of the question. So the initial question is, all right, if it's the home of the wire, which means there's incarceration, there's arrest rates, there's drug, all of these other things, what is the impact of these arrests and incarceration on the people and the neighborhoods? Like, not just what are the rates, right? But what is the impact? So that's the long-term question that we will be working through. We're going to the next phase in next year. And that question came from conversations with community members.
Yeah.
Who said, especially our, returning citizens. We had some conversations with returning citizens, and this is what they were saying. They were like, we've been incarcerated. Like, we've gone to that level, but we have people that we know who may not have even been incarcerated, but they're getting arrested. They may not be charged, but there is an impact that is happening on our communities.
Yeah.
And so that's the kind of thing that drives it actually. So I haven't even gone to the second bucket, but that drives one of our other buckets, which is our research. So like one of our buckets is research, but our research is coming from the community. And so it's like, to me, they're intertwined. I can't separate community from research. I can't say I'm the researcher, and so you're gonna do this, or I'm gonna say this, and I'm gonna get the answer. No, this was the question. And so what our student was able to do this past semester was really break down the top 25 highest incarceration neighborhoods, the top 25 lowest incarceration neighborhoods, and do a full comparison of arrest rates, socioeconomic status, housing stock, like all of these things she's been able to pull together to do a comparison.
Yeah.
And this is just the start, right? Like, we haven't even answered the question of the impact, but the impact is starting to even emerge from this, because you're seeing in these higher rates of incarceration neighborhoods, you're seeing the disinvestment, you're seeing the lower housing stock, the lower socioeconomic status, and things of that nature, and being able to say, okay, this is even before we dig down to at the individual level, this is the population level, what is happening to our communities. And what I think is very, very interesting is that's not a question I would have come to on my own.
On your own, yeah.
But it's a question that is important to us all. And this person literally came, and like the person who phrased it the exact way that we were getting to, like, we're just like, wow. Like, we're sitting there, we're like, oh, wow. like what is the impact, right? Because everybody talks about this is how bad it is, but no one talks about the impact on the families, on the communities. When you get arrested and not charged, so you've missed a shift at work. Yeah. And we're already precariously, living paycheck to paycheck. And if you're lucky, you get to go back and do, you speak to your boss and you get to another shift another day. But if you're not lucky and you miss that shift, you've lost your job.
When you talk about impact, I think a lot of times, depending on where a researcher is or depending on where a community member is, they may or may not be able to express what the impact is or how important it is. But when you find places or find ways to take that time and really consider what that community member is saying, what their researcher is saying, because a lot of times I express to our group says, hey, I know for researchers, you need input from the community in order for your research to flow. Cool, I get it. But you have to find a way to address some of the impact issues that will come up during this time, because that community member has just as much as experience as you do with all the letters behind your name. Their lived experiences count as well. But when we do that, though, when we find a way for both sides to understand, it's great because they both have a seat at the table. They're both creating. They're both throwing ideas back and forth. That bi-directional learning is happening. There's only reason why our podcast is called The Bridge, because this is what we want to do here on this podcast. We want to bridge conversations with community leaders. We want to bridge conversations with exec directors of programs who literally meet the community where they are. They recognize that there's some trauma there, and they strategize and have a plan on how they want to address it through collaboration, through innovation, and everything. So I'm excited for your program, Dr. Nadine, Dr. Nay. I know we've chit-chatted and talked a whole bunch, and you guys are doing great work over there. Before we get out of here, I just want to talk about some of the short-term and some of your long-term goals as it pertains to the organization. Maybe think about how do you plan to scale, and how do you address some of these challenges or issues that you face, whether it's dealing with community members or whether it's dealing with red, yellow, green tape, I like to call it, because there's so much of that going on as well too.
Okay. That's so funny. So the short term red, yellow, green tape, I like it, part is getting our physical office space 100% the way we want it. It's in terms of our long term, our short term, long term, real stuff for what we're doing is our short term thing is really taking that research question that I mentioned that came from a community member, and we're building it out. We're moving from the neighborhood to themselves, looking at the arrest rates and getting into some of that data. And over the next year, also adding into it, not just the numbers and the quantitative, but also looking at doing some key informant interviews and qualitative interviews of community members who have been impacted, and working with incarcerated citizens, returning citizens, and other people to help us to analyze the data, not just like as the participants, but to help us understand what people are saying, to make sure that we're interpreting what they tell us properly. So our short term is to really, I'm hoping by this point next year to have a full white paper that talks about the impact of arrest, but not necessarily incarceration, on the Baltimore community, that can be used and extrapolated across Maryland and nationally, so we understand the impact of something like, in New York, what they were doing with the stop and frisk, right? Like people were being stop and frisked or arrested and held and released.
Yeah.
The same level of impact. So we really want to put that together. So that's our short term, is to get that. Our middle-y, I would say, I
like that. Short, long, and right in the middle term.
It's like right in the middle, that we're working on over the course of this year, probably 2 years, and hoping to stand up maybe fall 25 or spring 2026, is we're working with the graduate school as well as, participants from many of the other schools, but it would go through the graduate school on some sort of certificate in violence prevention, and a baccalaureate certificate in violence prevention, as well as a master's degree in violence prevention, interdisciplinary master's degree in violence prevention.
Wow.
We're working with the graduate school to figure out what needs to be done. What do the courses need to look like? How can we make sure that community members are a part of these courses in terms of instructors because of their lived experience, but also how can we make sure that community members have access? So like, is it that we have to have some sort of grants to pay for them, some sort of sliding fee? How do we make sure that community members can access and get these certificates and get this specific type of master's degree for violence prevention? Because we know our smaller nonprofits could benefit from having staff.
That's exactly what I was
have these types of certificates and master's degrees, and why not be the ones to offer it for them? So that's like our middle one, because I think that,
I like that.
Like I said, in a perfect world, I would love to have it ready for people to apply in January and start next fall, but I don't think that's going to happen. It's going to take us the next year probably to put this together. So I'm hoping that would be able to have it somewhere in 25, 26.
Yeah.
And then our long-term goal is really to make sure that this center is sustainable and becomes, and this is my pie in the sky, some sort of national center for injury and violence prevention that's like the marquee for the United States type thing. Like that's like long term, really pie in the sky. But I'm sure there'll be some version of that,
Yes.
What I would like us to, that's where I want us to be at probably by year 10.
I love it. Dr. Nay, I love the approach that you have had ever since I first met you when it comes to bringing this program to the university, addressing the issues here in Baltimore. I love the idea that you're co-collaborating with the community members and the researchers here on campus. You guys have ideas about where you want to go. I love that. And then you provide an opportunity for those resources and those stakeholders. You mentioned it earlier. You're talking about nonprofit organizations having an opportunity to get certified or get a master's degree in learning exactly how to be a resource for the community, a tangible resource for the community. That's fantastic. And then again, the long-term goal about going national or being the marquee specialists or experts in this degree. I met a lot of people that have been mentors in my life, and my basketball coach, high school basketball coach, Pete Pompey, always told me, if you shoot for the moon and you miss, at least you're amongst the stars. You guys are shooting out there, and I love it. And I know you guys are going to reach the moon, but if not, the stars are going to be great for you. Dr. Nay, before we get out of here, I got one last question for you.
Uh-oh.
And I've been working on this question, something I want to kind of coin and ask my guests when they join. If you could go back and talk to Dr. Nadine Finigan-Carr a year ago from now.
Oh, I would say, I think the one thing that I would do differently, and it really is because we've been very intentional every step of the way. I think the one thing that I would do differently, that I would tell her to do differently, is start hiring sooner.
Okay.
I think I mean, and I started relatively early. I mean, the processes of red tape to get something posted, get it hired. But it would be to start a little bit sooner. I think if we had a little bit more of a contingent, I mean, my people started in August and September. And I'd been working a good number of months, and I actually started, I think, the center started May 1st. I started February 17th. Like the minute the minute the cat was out of the bag,
I remember.
Meetings started, right?
I remember those exchanging emails and stuff like that.
Yeah. So I would say to start, I would have started hiring people February 17th, but I wouldn't have had it. But I know I wouldn't have had enough knowledge of who I needed at that point. So, that if I could have changed it with the amount of knowledge I have now, though, I would have started hiring sooner, but I wouldn't have done much different.
That's great. Well, you guys are a great team over there. I know you're not many, but again, you are strong. You're mighty. You got
all but mighty.
Yes. Every time I see you guys out and about the community, I love it. And the Patients Program is a fan of your work over there. I know you and Dr. Mullins have exchanged emails, meetings, and chit-chatting and talking.
Yes, I was blessed. I was very blessed that Dr. Mullins was one of my first mentors when I got to the University of Maryland. I was connected to him and had to work with, the person who told me I was working under him, and very quickly Dr. Mullins said, no, you're working with me. And I was blessed from that day to have that relationship with him, and he's been very supportive. So I appreciate it.
That sounds great. I'll be sure he'll listen to this and he'll appreciate those kind of words. And Dr. Nay, as always, it's great chit-chatting to you, talking to you. The Patients Program, again, like I mentioned to you, is a fan. If you ever need anything on our side, don't hesitate to give me a call. But I know we'll stay connected in this journey because we do share synergies with co-collaborating, meet the community where they are, and giving folks a voice. So thank you much, Dr. Nay, and I'll see you around.
All right. Thank you, Rodney.
Thank you for listening to The Bridge. Your health, your voice. To learn more about the Patients Program, visit our website, at www.patients.umaryland.edu.